Hello and welcome to a new episode of Majlis podcast by Emirates Hospital Group. My name is 𝗠𝗷𝗶𝘀𝗀. I'm a family medicine consultant. Today's topic is quite basic but very essential. A very common condition, lots of misunderstandings about iron deficiency, the importance of iron, and the relationship with anemia. It is my pleasure today to have Dr. Sheena, internal medicine doctor at Emirates Hospital Jumeirah. Dr. Sheena.
Hi, I'm Dr. Sheena Cherry, internal medicine specialist from Emirates Hospital Jumeirah, and here to talk about iron deficiencies and the risk factors based on that.
Most welcome and very happy to have you here. And like I said, it's a very important topic, quite common. Okay, so let's start with basics. What is iron deficiency and what is iron deficiency anemia? Is there a difference? Is it the same thing? And why is iron that important?
So basically, let me start with talking to you about what is iron. So iron is a very vital part of a human body, which is usually absorbed from a good food source. Not many people know about this, but so in the body as an adult, about 3 to 4 grams is usually stored in the hemoglobin, which is the present in the red blood cells, and about 2.5 of which grams is stored in the ferritin. So ferritin is a protein which binds with the iron. Now, these iron, when it is usually present in your body, for an adult and a male and an adult female, it's different. Let's say for an adult, per day, he would consume around 20 milligrams of iron in his food. About 10% he would be absorbing it, and then he would lose around 1% in GI epithelial cells. And in women, mostly during her menstrual period, she would lose around 30 milligrams of iron. So this is like a basic thing about iron. Now coming to iron deficiency, when this iron, that sources that we have, is lost or its level is very low in the body, then we call it as an iron deficiency. And when hemoglobin is also low along with it, we call it an iron deficiency anemia.
Okay.
Yeah. So it has a lot of vital functions when it comes to iron's play in our body. So one of these most important thing would be hematopoiesis, which is like blood cell production. Now the most 3 important blood cell production would be the red blood cells, which helps in transporting oxygen from the oxygenated lung to the tissues and the muscles. And the WBC cells, which helps in fighting the immunity, and the platelets, which helps in preventing the bleeding. So this is one of the most important roles of iron. The second would be it helps in growth and mental functions. The third, it would be in helping production of new cells, amino acids, catalysts, neurotransmitters, and some hormones like hepcidin, which is very important to the body. The fourth would be it helps in energy production, like conversion of blood sugar to energy.
Okay, thank you very much. And that was very good introduction to the topic.
Yeah.
You mentioned while you're discussing the types of iron is that women lose a lot of blood, of course,
Yes.
during their menstrual cycle. So I would assume they are one of the people at risk of iron deficiency.
Yes.
Who else is at risk of iron deficiency in your experience? And what are, before I talk about treatment, because it's always prevention. So what can I do if I'm at risk? How can I prevent this happening? Is there something I can do with my lifestyle, with my eating habits?
Yes. So what you can do is mostly the people who are at risk other than women would be vegetarians.
I see.
Because the plant-based diet is mostly non-heme iron and they have a low bioavailability of iron. So vegetarians are more prone for iron deficiency. So what you can do is if you're a vegetarian, you can increase your supplement irons or probably take foods which are rich in iron like almonds, which is very good in iron, spinach, kale, dates, probably like about 3 to 4 dates per day. So these can help you to increase your iron. Other than that, infants. So infants around 6 to 12 months of age, if the mother who's feeding him has less iron stores, then he is more prone for having iron deficiency. Teenagers, especially when their growth spurt is high, because of increased depletion of their iron storage, they also go for iron deficiency. Children, in most of the tropical countries, we have a lot of cows. Yeah, so we give them cow milk. And cow milk has a protein called casein. This interferes with iron absorption. So children around 1 to 2 years of age who are taking a lot of cow milk can also have iron deficiencies. And athletes, like marathon runners, they can have increased sweating, microischemia, and this can cause them to deplete the iron storage. So these people are more prone for iron deficiency.
Thank you very much. That's quite a list actually of patients, which means that in terms of awareness, if you're one of those people, for anyone listening to us today, please make sure you get checked, even if you're doing your best in terms of dietary. So the best way to do it is to check, right?
Yes.
Okay, fair enough. So thank you for the summary in terms of this, like where we eat it. But when do I need to check? So I'm one of those, let's say I'm one of those groups that you mentioned in kind of people at risk, and I'm doing my best. And I know we were saying that the best way to know is to get checked. But when do I know I need to check? What are the symptoms or the common symptoms that I should watch for? Or if I'm a parent, that I should watch in my kids or my friends, that I should alarm them that, by the way, have you had your iron checked?
Yes. So there are a few symptoms very, very common. The first symptom would be a lot of fatigue. So the patient would probably tell you that he sleeps a good amount of hours, maybe 6 to 7, and still wakes up tired. So that can be one of the most common symptoms. A very foggy memory, brittle nails, brittle hair. They would have, sometimes they would have a pale skin. Pica, which is very common for a lot of people, which is craving for dirt, and bricks and ice cubes. So if they have a craving for ice cubes, a lot of ice cubes, yes, they can probably think one of the symptoms. And palpitations, breathing difficulty. Even when you exercise a little bit, you have a breathing difficulty. Most cases, if it is a severe form of anemia, they would probably even end up with palpitations and postural hypotensions, which means like they feel giddy most of the time when they sit down and stand up. So these symptoms are predominant, and they've been experiencing this for more than a week or so. They would need to seek prompt medical advice and come to us.
Well, for a second, I thought you're describing me when you're talking about fatigue and pale hair and all of that. So, but except for pica, then I know that it's not me. But joke aside, the idea is that basically that if I have any of those symptoms, which are actually quite general, because listening to what you're saying, they could fit in many other conditions, it's always better to be checked to know that if it's iron or something else. So what do I expect? I took an appointment, I came to see you not because I'm worried about iron. I came to see you because my hair is getting thinner. I'm tired. I'm a bit more breathless. I used to exercise more. Now I feel more tired. What do I expect? I mean, what will happen next? And there's always that fear, because probably people, the minute they put weight loss or fatigue online, I would get cancer. So I'm always worried. I'm afraid. So what do I expect in terms of the consultation?
Right. Not all these symptoms are very generalized, and it just doesn't have to be iron deficiency. But when you come to us, we would probably take a more generalized a history of what exactly is wrong with you, how long you've been having these symptoms, look for some signs. So the signs would be, again, a pale skin, probably a concave nail or like a spoon-shaped nails. This is most commonly because of the reduced nail connective tissue. Then a glossitis, which is a flat tongue, which is because of the reduced myoglobin, which causes the muscle on the tongue also to go flat. Then they can have a postural hypotension. When you make them sit down and stand up, the blood pressure falls. And some symptoms, sometimes even severe anemia, can have pedal edema. So all these symptoms we can see. And if you think of all these symptoms, the patient is having a iron deficiency, a suspected iron deficiency, then we would suggest them a blood test. Yeah.
And then the blood test will be mostly about iron?
The blood test would mostly be just a basic blood test first to see a complete blood count, which will show your hemoglobin levels. If your hemoglobin is low, then you would suggest them to do a hematocrit levels, a ferritin level, because ferritin is basically the storage source of iron. So if ferritin is low, then you need to see the MCV and the RBC indices. MCV would be low, RBC indices would be high, and the total iron binding capacity would be high. Okay, because the liver produces the transferrin, which is basically the transport source. When the storage is low, it helps to it because of the low storage, and because liver has to accommodate the iron to the other parts of the body, it transfers more. So thereby the TIBC would be high. Now, if you think all these levels fit into the description of iron deficiency, you can ask for a peripheral smear, where you can see a microcytic hypochromic anemia, which means the size of the blood cells would be small and more paler. And certain times you can even go for a bone marrow, where you can see a micronormoblast. If all these are coming into the picture and looking like an iron deficiency, then you need to know what is the cause. most commonly for men, it can be some GI causes, like a fresh bleed, or probably some peptic ulcers. So you can suggest them to have an endoscopy to see for an upper bleed, or an colonoscopy to see if they have any cancers or polyps or some fresh bleeds.
Okay, interesting.
Yeah.
And that's a very important point you highlighted, that it's
Yes.
not about iron.
No.
Because I see a lot of patients coming in, and it's by default, by nature. If I receive my blood results and I don't know what, the first thing I'm going to look for is the iron level.
Yes.
I see my iron level normal, then I feel relieved. Whereas you mentioned very nicely that there are actually more indices that we have to take into
Yes.
consideration.
Yes.
Okay. Okay.
Because it's not just iron deficiency. Hemoglobin being low can cause, like, genetic causes can be reasons. Because Middle East, there's loads of people have thalassemia. There's loads of other kinds of deficiencies that we have to also rule out before ruling out iron deficiency.
Fair
Not
enough.
everything is nutritional cause.
Now, let's say I came to see you. You told me I have iron deficiency. I'm not great with compliant with medications. I took a bit of supplements and I forgot. Life kicked in and I forgot. What are the risks? What are the kind of the potential side effects of me ignoring iron as a person, irrespective of gender?
So first thing, as doctors, I think we need to mention to them the importance of them having to be very oriented with the medications and following up properly with the medications. Once we suggest them based on the iron levels, an oral tablet or a parenteral infusions. Now, if they don't follow it up, they're probably going to come back to us in 3 to 6 months, probably with more amount of fatigue. Yeah. This is because the oxygen supply is low, because hemoglobin is less in the body, and because of the transport is less. They can have heart failure because of the increased stroke volume, reduced blood supply to the kidneys. They can have palpitations. They can have irregular heartbeats. They can have all the symptoms that I told you, like the increased glossitis and koilonychia and all that. The menstrual bleeding can also be one of the main reasons. As in women, you can have all these symptoms increasing. If you're pregnant and then you're not following up through, during the pregnancy, you can have postpartum depression, you can have palpitation, you can have reduced breast milk. And for the child, the infant, which is in the stomach, the child is going to have reduced growth. Probably like immunity is going to be reduced for the baby. The cognition is going to be reduced for the baby. So, and even developmental delay. So all these can happen.
And that's
so
quite a list.
Yes. So we have to explain everything to them in detail, I think, when they come to see us in the hospital, because I think it is our duty to do that. And once we do that, and then the regular follow-up, I think it's an easily treatable disease.
Fair enough. It's an exciting topic. I promise one more question, and then before we bring this to an end, because you mentioned very serious complications, and the price is just to kind of, if I may say, the price or the cost is just to kind of comply with the iron supplements, ideally treating the cause, like you said earlier, if we can. But I hear and I see a lot of patients saying that, doctor, I don't like iron. It gives me side effects. It gives me makes me bloated. It gives me kind of weird, unusual gastrointestinal symptoms, despite the newer ones in the market. And then you have a lot of patients who don't want to try even the oral tablets at all. They want to go straight to IV, the infusion. What's your approach, please?
So there are newer liposomal ions which actually doesn't give all the symptoms. So I think back in the days, yes, it like syrup oral iron used to give them a lot of problem, like metallic taste, tingling, constipation, and all that. The newer forms of iron, oral ions, the smaller doses, they don't give any symptoms as such. Especially my patients, I give them a lot of oral tablets, like about 30 mg to 50 mg of iron according to the CDC recommendation. With liposomal or ascorbic acid, we give them, and they don't seem to have any complaints with it. So probably we'll enforce it more and then ask them to try it, and then they'll be good with it.
And then if for any reason they're not, well, they are compliant, but it didn't work, then you might consider the infusion.
A parenteral iron infusion, yes, for definitely. Because oral iron, or if it is not working, because oral iron, again, sometimes if you have a severe iron deficiency and you're going to put them on an oral iron, the depletion is going to be more because of less storage in the body. So it would be always better to go for a parenteral iron infusion and then probably put them on a maintenance dose of a little dose of oral ions.
But the main point is that there is treatment, and it is relatively easy, it's affordable, and it's very beneficial.
It is very much affordable and very beneficial if the patient regularly follow up. Probably like if they take an oral iron, they can come after 1 month or 3 months and see the doctor. If it's a parenteral iron, after 3 months they can see the doctor. They can get their levels checked because it's just basic test which is approved by all the insurance, and we are all readily available in the hospital to help them with all the questions and the treatment follow-ups.
Absolutely. So it's mostly about awareness, and hopefully that's what we're doing today.
Yes.
Dr. Sheena, it was really a pleasure. It was just enjoyable chat today about iron deficiency and relationship with anemia. Any last message you want to tell our audience today?
So the key points would be have a regular checkup with your doctor, your personal doctor, so you can get to know what exactly is wrong with you. If you have a deficiency which is nutrition based, it can be easily corrected. If it is something more than that, you have to go for an early intervention, which could also save your life. And pregnant women, menstruating women and children has to be more cautious when it comes to iron deficiency, because they are going to help them with the quality of life. So
Thank you very much for this. And this brings us to the end of today's session about iron deficiency. Thank you very much for listening, and stay tuned for further sessions soon. Dr. Sheena, thank you very much for being with us today.
Thank you.